Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. 0.13 Causes of a metallic taste in your mouth. A metallic taste in your mouth, known as dysgeusia, can be caused by many different things. These can range from oral hygiene problems and respiratory infections to neurological disorders and nutritional deficiencies. /r/n/r/n These and other conditions can affect the nerves associated with taste, gestation. A metallic taste may also be due to conditions that affect nerve receptors on the tongue and taste buds. They could also affect nerve receptors for smell, olfaction, which contributes to your sense of taste. /r/n/r/n Most cases of dysgeusia resolve over time, although some people may experience a metallic taste in their mouth for a long time or permanently. Different treatments are available to correct the abnormal taste sensations depending on the underlying cause. /r/n/r/nVerywell, Lara Antalrnrn Gingivitis or periodontal disease often results from poor oral hygiene. Poor oral hygiene habits can lead to a condition known as acute necrotizing ulcerative gingivitis, ANUG, commonly known as trench mouth. /r/n/r/n With trench mouth, the metallic taste in the mouth mainly arises from bleeding gums. As the blood oxidizes, it releases ions and produces a metallic taste. Trench mouth also causes mouth inflammation, which can directly damage taste buds and reduce their function. /r/n/r/n Good oral hygiene and treatment from a periodontist can usually reverse this. /r/n/r/n Upper respiratory infections can sometimes lead to a metallic taste. This is largely the result of inflammation of the tongue and other oropharyngeal tissues of the mouth, including the soft palate, throat, and tonsils. Inflammation alters your taste receptors and your overall sense of taste. /r/n/r/n Upper respiratory infections can also cause nasal congestion, which can impede not only your ability to smell but also your ability to taste. /r/n/r/n Upper respiratory infections that can cause dysgeusia include /r/n/r/n Middle ear infections can also do the same, as the inflammation can spread from the eustachian tubes to the throat. /r/n/r/n Dysgeusia will generally resolve once the infection clears. However, some infections like COVID-19 can take longer, returning to normal within 6 months. /r/n/r/n Hormonal changes during pregnancy can cause disturbances in taste and smell, manifesting with a metallic taste. This is more common during the first trimester of pregnancy due to increases in human chorionic gonadotropin, HCG, the same hormone implicated in morning sickness. /r/n/r/n As the pregnancy continues and HCG levels drop, the abnormal taste sensation usually subsides. /r/n/r/n Rapidly rising estrogen and progesterone levels can also make your saliva more acidic, which can alter the flavor of foods. /r/n/r/n Numerous medications can leave behind a metallic taste because they directly or indirectly interfere with nerve impulses to a part of the brain called the gustatory cortex. /r/n/r/n Drugs commonly associated with this include /r/n/r/n Dysgeusia will typically resolve once the drug is discontinued. It is important to note that not all drugs in a drug class will cause a metallic taste, and changing to an alternate drug of the same class will often resolve the issue. /r/n/r/n Neurological disorders commonly cause dysgeusia and a metallic taste by disrupting the normal transmission of nerve signals to the gustatory complex. /r/n/r/n This can occur when certain neurological diseases cause plaques or tumors in the brain that directly block nerve signals. Other diseases damage the nerves themselves, including demyelinating diseases that destroy the protective coating of nerve cells, causing them to misfire. /r/n/r/n Neurological disorders associated with dysgeusia and metallic taste include /r/n/r/n The treatment of certain neurological conditions, like brain tumors, may help resolve the abnormal taste sensations. With that said, dysgeusia associated with neurological disorders is harder to treat because the underlying conditions are often persistent or progressive. /r/n/r/n Dysgeusia and metallic taste are a common side effect after ear surgeries, including procedures like tympanoplasty to repair the eardrum and mastoidectomy used to remove the mastoid bone. /r/n/r/n These procedures can sometimes damage a specific nerve called the cauda tympani nerve responsible for taste sensations on the sides of your tongue. If such damage occurs, the effect may be permanent. /r/n/r/n Dysgeusia may be corrected by having the cauda tympani nerve removed. However, doing so may also reduce certain taste sensations, like the ability to detect sour tastes. /r/n/r/n Mouth injuries, such as biting your tongue, or oral surgery, such as wisdom tooth removal or a tonsillectomy, can also sometimes lead to a metallic taste in your mouth. /r/n/r/n The abnormal taste may be due to bleeding and might linger until your wounds heal. In other cases, the surgery can damage a nerve, called the glossopharyngeal nerve, which is involved with taste. This can lead to prolonged and even permanently altered taste sensations. /r/n/r/n Heavy metals found in certain vitamin and mineral supplements can cause temporary altered taste sensations, including a metallic taste. These include supplements containing high levels of /r/n/r/n Dysgeusia is more likely when supplements like these are overused. Women often experience dysgeusia when taking prenatal vitamins due to the high levels of iron they typically contain. /r/n/r/n Discontinuation of these supplements can usually resolve the symptoms. /r/n/r/n On the flip side, being low in vitamins B, vitamin C, zinc, and copper can cause abnormal taste sensations because each of these is involved with nerve transmission, including those involved with taste. /r/n/r/n This is especially true of Z. North Carolina, a trace metal that is essential to the normal functioning of your taste buds. Zinc deficiency reduces the amount of an enzyme called gustin essential to the growth and turnover of taste bud cells. /r/n/r/n Many things can cause zinc deficiency and, in turn, the onset of dysgeusia and metallic taste, including /r/n/r/n The proper treatment or management of these diseases can help alleviate symptoms. Zinc supplementation may also help. /r/n/r/n Pine nuts are edible seeds produced by pine trees. Eating them can sometimes cause a phenomenon known as pine nut syndrome, in which you develop a strong metallic taste in your mouth. The sensation can start 12 to 48 hours after eating pine nuts and may last for up to 4 weeks. /r/n/r/n Pine nut syndrome is especially common with pine nuts imported from the Shanxi and Shanxi regions of China. The symptom is thought to be triggered by certain fatty acids in these pine tree species and may only affect people with certain genetic variations of their taste buds. /r/n/r/n To reduce your risk, only eat pine nuts produced in North America or Europe. If an abnormal taste occurs, throw away the pine nuts, and don't be distressed if it takes time for the metallic taste to subside. /r/n/r/n A metallic taste is common with chemotherapy and radiation for similar reasons. /r/n/r/n With chemotherapy, drugs like bleomycin, cisplatin, and fluorosilitacan destroy fast-replicating cells in the body. This not only includes cancer cells but also normal cells like those in your taste buds. The destruction and reduced turnover of taste buds account for why 75% of people on chemotherapy report dysgeusia. /r/n/r/n Radiation for head and neck cancers can do the same thing, directly destroying taste buds as well as nerves involved with gustation. /r/n/r/n Upon completion of chemotherapy and radiation, normal taste sensations will gradually return but can take anywhere from 3 to 12 months depending on the extent of treatment. /r/n/r/n Excessive exposure to heavy metals like mercury and lead can cause a metallic taste as the metals accumulate in your tissues. In fact, a metallic taste is often the first sign of mercury or lead poisoning, which can also damage nerves involved with motor skills, language, cognition, and sensations such as touch and smell. /r/n/r/n Mercury poisoning is typically caused by eating high quantities of fish contaminated with a form of mercury called methylmercury. /r/n/r/n Lead poisoning often occurs when drinking water from older plumbing systems made of lead. Occupational exposure to lead is common in smelting factories and mines. /r/n/r/n Once lead or mercury gets into your tissues, it may require the use of special drugs, called chelation therapy, that bind to the metals and help you pee them out. /r/n/r/n Rheumatoid arthritis, Sjögren's syndrome, and lupus are three autoimmune diseases in which dysgeusia is a common feature. Autoimmune diseases are those in which the immune system inappropriately attacks normal cells and tissues. /r/n/r/n The underlying cause of a metallic taste differs by the autoimmune disease. /r/n/r/n Dysgeusia most often occurs during acute flare-ups, exacerbations, of these diseases. Keeping them in check with medications can help reduce flare-ups. Artificial saliva may also help normalize taste in people with Sjögren's syndrome. /r/n/r/n Treating dysgeusia typically involves treating the underlying condition. With that said, staying hydrated and preventing dry mouth can help reduce dysgeusia in most cases. /r/n/r/n If you smoke or use tobacco in any form, it's important to quit. Tobacco contains nicotine, which reduces saliva flow and results in dry mouth. /r/n/r/n In addition to drinking plenty of water, other strategies that may help reduce metallic taste include /r/n/r/n A metallic taste in your mouth may be caused by gum disease, poor oral hygiene, burning mouth syndrome, a mouth injury, or recent oral surgery. Medication, vitamins, a food allergy, and sinus problems can also cause the unpleasant sensation. /r/n/r/n It's usually nothing to worry about unless the taste persists or you develop other symptoms, like a fever. Then it's time to see your healthcare provider. Treating the condition, staying hydrated, and maintaining good oral health can help minimize the metallic taste. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.